you ready if you want to make a little statement first, and we'll ask you questions, Doctor?
Sure. I would just say that the mayor is doing quite well. He's resting comfortably over at St. Vincent, resting with his family. I expect a good recovery, home tomorrow, and back to work sometime towards the end of next week. And it was an uneventful procedure.
How long did it last?
It took about 45 minutes to do the procedure, and he was under a general anesthetic, but which is a safe and normal technique for this procedure.
Dr. Lund, you did talk about it a little bit 2 weeks ago, but if you can go into detail about the type of procedure that the mayor underwent and the purpose of it.
So yes, the mayor underwent a transurethral resection of the prostate, which is a technique where we remove the obstructing prostate for voiding symptoms. The mayor was having difficulty with emptying his bladder properly and so forth. And so as a consequence, this is a fairly typical procedure that we do on men as their prostates get bigger.
Is this a portion of the prostate was removed, or the entirety?
Only a portion, only the obstructive portion of the prostate. So what the implication of that is that this was not designed to remove his prostate cancer, as we had discussed before. And so he will, at some later date, undergo further treatment for his prostate cancer. And I would expect him to do quite well from that procedure also, or that treatment.
Would that come before or after he begins the radiation and begins all that?
The additional treatment for the prostate cancer will include radiation therapy. And so that will be probably in a few months from now, after he's fully recovered from this procedure.
Usually, what are some of the post-procedure healing that he has to do? Is it soreness? What generally happens?
It's actually a fairly comfortable recovery. The process just entails sort of normal behaviors without doing too much heavy lifting, but he shouldn't be terribly uncomfortable. There can be some bladder irritability after this procedure, so I usually advise men to be close to a bathroom and try to stay close to home when they are recovering, and that usually only takes about a week.
Did you get a chance to talk to him after he came out of surgery, and if so, what did he say to you?
Yeah, I saw him afterwards, and typical of the mayor, he was grateful for the procedure and thankful to all the wonderful care that he got. So, but he was in good spirits, and he's actually looking forward to going home.
Dr. Lund, can you talk a little bit about the procedure? This is not, there's no incision made. We
Correct.
talked about this a little bit 2 weeks ago, but if you can go through it again, how is this typically done?
Yeah, this is done what we call endoscopically, so it's done through a scope through the normal urinary channel, and the scope has the technique of being able to remove the obstructing prostate. We do rely on Mother Nature to allow that channel to heal spontaneously, so that I make the analogy, it's like a scab on a knee. It kind of re-heals over time, and it just has to, what we call re-epithelialize, which is a process of growing a new lining that occurs, and that happens over a period of anywhere from a couple weeks to a couple months.
How long do you anticipate him being before he can resume at least some of his duties as mayor?
I think he probably, knowing the mayor, he probably won't stay away long. And I if I can hold him down to next week, I think I'm going to be lucky. Yeah.
Going back to the procedure itself, how is that portion of the prostate removed? I think you mentioned using electrical.
Right. So it's a cautery loop, which is an ability to vaporize and cut the prostate. And of course, this is done under an anesthetic, so the patient is comfortable.
What are the different things that you guys will be monitoring overnight during his stay?
So we'll be doing the typical monitoring that they do in the nursing floor, which is blood pressures and pulses and temperatures. And we'll be checking his urine output to verify that he's got good urine production. They'll do the cognitive analysis, making sure that he's alert and when he's not sleeping and so forth. those are mostly typical nursing care processes.
Did you do any exploratory surgery or anything?
No, this was just going in with the set purpose of removing the obstructive prostate.
Is it correct to say, what part of the prostate is usually removed in this? You said it's the part that is blocking or pressing on the
Yeah, so imagine the prostate like a collar around your neck, and as it grows, it strangles that area that you have to urinate through. And there is a glandular, the center core of the prostate is really formed of glands, and that's the portion that we actually remove in this process. So basically coring out the prostate in a more simplified term.
Who was with the mayor? Is it just his wife or some of
His
his
wife and his children,
His
yes.
children too?
Yeah, he has 2 children that came in from out of town, which
And again, Dr. Lund, this is a procedure you do frequently.
yes.
You did another one today.
Right.
Roughly over the course of a month, how many do you typically do?
Oh, it varies, but probably 10 or 12 a month would be not unusual.
All right. Thank you very much, Dr. Lund.
Oh, you're
Appreciate it,
welcome.
as always.
Yeah.